Hi, my name is Dr. Chris Layton. I work at Chiro-Med in Orland Park, Illinois. We've been doing a series of videos talking about different spinal conditions, and today's condition we're going to talk about is cervical hypolordosis. Cervical hypolordosis means a loss of the cervical curve. So when we look at x-rays and we look at somebody facing this direction, there should be a curve in their spine. This blue line indicates what that normal curve should be. As we measure through, it should be about 43 degrees. Here you can see where they start coming up this way, their head goes forward, and their first cervical vertebrae does not drop directly over the center of their last cervical vertebrae. So C1 over C7. You can actually see their spine starting to turn the wrong way. Here we have another example where their spine is basically just straight up and down, like a rod, like a stick. And again, here you can see where their spine's more straight instead of having that curve. The problem with that is we have an 8-pound head sitting on top of our spine. That 8-pound head, as it starts to drop forward, weighs more than the 8 pounds. You can have up to an extra 5 times amount of pressure due to that forward head posture. So you're making your head feel like it's about 40 pounds. Normally patients would present with neck pain, upper back pain, maybe headaches that come and go due to that increased pressure they start to feel in the neck and the upper back due to this. It used to be that we only saw this due to trauma, so whiplash like car accidents, maybe a hit in football, or something like gymnastics falling off apparatus. Now we see it more frequently. It starts from school, looking down at the desk all day, coming home, looking at the laptop, looking at tablets, iPads, their phones. Everybody does this all day long. So it's that recurrent trauma day after day, overstretching those muscles in the back of the neck. So it doesn't take trauma anymore to induce this type of activity. This is an 18-year-old patient that's never had any type of trauma, no sports injuries, no car accidents, and has lost that curve in their neck. She came in complaining of neck and upper back pain, headaches that come and go. So classic now for what we see for cervical hypolordosis, or forward head posture. Treatment for it is chiropractic adjustments, get the spine moving the way it's supposed to, and then we use stretching and exercise protocols to help induce that cervical curve to get it back to that 43 degree mark where it should be. So another name for this is also text neck, because so many kids today turning around looking at their phones, spending so much time in that forward flexed position, cause a lengthening of those muscles through the back of the neck and contracture or shortening of the muscles on the front side of the neck, maintaining that forward head posture. As they do that, they start to put pressure into the joints, which can lead to early degenerative changes, wear and tear, irritation to the nerves, and then obviously the muscle pain that goes along with that. So it feels good when somebody does any kind of work with the muscles on the back of the neck to do a massage, because there's increased tension in those muscles. But the problem tends to be more on the front side of the neck, into the scalenes and SCMs, so those muscles become contractured or shortened, needing to be lengthened to allow them to get their head back over their shoulders, lengthening the pecs to allow them to open their chest to get their head back over their shoulders. There's not necessarily neurological findings that you'll find with that initially. So not necessarily a loss of dermatome patterns or reflex patterns. The reflexes tend to be normal. What you tend to see is more muscular changes, and then the changes that you see on radiograph or on x-ray findings. We were talking about cervical hypolordosis, so the loss of the cervical curve. So as we're working with the patient, part of what we want to do is evaluate what's going on with them muscular-wise and with the joints. A lot of times what you're going to find is muscular tension going from the base of the skull down to the tops of the shoulder blades, from the base of the skull down in between the shoulder blades and through the front of the shoulders. So as I palpate her neck, I can find the areas of muscular tension and the joints that are fixated or subluxated. So that's what we're looking to correct. So part of it is stretching, and we'll give you the abbreviated version, but to help loosen things up initially. Come lie back on your back, please. Slide up 20. A lot of the muscular Tension tends to be in the SCMs and the scalings. So the scalings here, SCM here. So as we stretch, loosening those muscles up. That way they can work on getting head retraction or bringing their head back over their shoulders. And then some cervical traction to help open up those joints. And the most important part, the adjustment. Relax this way for me. Hands behind your head, please. So as the head goes forward, it creates a lot of tension at the CT junction or where the neck meets the upper back. Relax for me. So they tend to get anteriors or vertebrae that pull forward. So we want to bring those back. And there you saw the treatment for cervical hypolordosis.